We are now on air reporting the news covering Malaysia's COVID-19 current situation here in ASEAN Studios live this morning. We have 4 reporters in Malaysia right now who will be updating us in this matter. To give us the latest general updates with the current number of affected and recovered Malaysian residents, here is reporter Mary, live in the country of Malaysia. Mary?
Yes, Kathleen, as of July 12, there has been a total of 78,660 new confirmed cases of COVID-19. According to the World Health Organization, there has been a total of 951,884 confirmed cases in Malaysia from January 3, 2020 to July 22, 2021. The Malaysian government started administering Pfizer vaccines last February 2. Khairi Jamaluddin, the Minister for the Malaysian Government for the Malaysia Science, Technology and Innovation, also mentioned that 80% of the population can have enough vaccination by October 2021. This is reporter Mary. Back to you in the studio, Kathleen.
Thank you, reporter Mary, and that was reporter Mary live in Malaysia. Giving us the latest updates regarding the cases in the country, we are now moving forward to the challenges the Malaysian authorities and the residents are facing in the current situation. As Malaysia deals with a series of problems due to COVID-19, Malaysia is still in the binge of collapse with regards to the healthcare system. Let's find out more through reporter Reyn. Reporter Reyn?
Thank you, Kathleen. Mental health is never taken as a serious issue in Malaysia, even in this pandemic. It has affected everyone, whether it be students, employees, the elderly, even little kids, but especially healthcare workers. Rates of mental health issues have already tripled in the past 2 decades, and roughly 500,000 people have reported symptoms of depression. This is demonstrated by the rise in cases of domestic violence, suicides, and stress. And of course, with the sudden influx of patients with limited resources to handle the health emergency, has garnered frontliners fatigued. Additionally, uncertainties in daily changes in COVID guidelines and the fear of being infected further increase their anxieties. Now, healthcare workers are facing burnout. Dr. Andrew Mohanraj, the president of the Malaysian Mental Health Association, has reported that there was a double increase in people seeking for help. Many women's centers and help hotlines have also received a significant surge of cases. The Malaysian government has so far not addressed this issue and is ill-equipped as they have only allocated less than 2% of the country's total budget for mental health. This is reporter Reyn. Back to you in the studio, Kathleen.
Thank you, reporter Reyn. Continuing with this issue, side by side with reporter Reyn, we now cover more on the struggles Malaysia faces in terms of education and other services covered by reporter Francesca. Still live in Malaysia. Reporter Francesca?
Yes, Kathleen. Aside from what reporter Reyn has stated, Malaysia has been suffering from a lot of challenges during the pandemic. One of it is mental health. According to government figures, rates of mental illness have tripled in the last 2 decades, with the country's economic burden estimated to reach $6 trillion by 2030. Approximately 500,000 Malaysians reported depression symptoms in the 2019 National Health and Morbidity Survey. Another one is disease containment. In the vaccination front, the government looked into several initiatives that may ensure Malaysians will adequately receive successfully developed COVID-19 vaccines from multiple sources worldwide. The government pledged their commitment to the Global COVID-19 Vaccine Global Access or COVAX partnership, spearheaded by WHO, while also collaborating with the Chinese government for the procurement of COVID-19 vaccines. The MOH developed My Sejahtera application that they also use for contact tracing, will serve as one of the platforms for vaccine selection, invitation, enrollment, side effects monitoring, and certification, while also reminding vaccinees of their second appointments when due. Another one is the threats to the healthcare system. The Malaysian MOH has since the outset prepared for the worst case scenarios and outlined the plan in clear and easily accessible guidelines. The test conducted by Malaysia from early on is more of a targeted testing. The MOH has also approved and received the first batch of antigen rapid testing kit from South Korea, which has a reported sensitivity level of 84.4%. The MOH has prepared several contingency plans looking into different best to worst case scenarios. Other inevitable threats to any healthcare systems are the adequacy of manpower and sufficiency of PPE supply. MOH has also called on private and retired medical staff to contribute in COVID-19 management nationwide, with a special budget allocated to hire them on contract. Learning and teaching is one of the struggles of every nation during this pandemic. Even with a higher literacy rate among its citizens, Malaysia still faces some constraints with the e-learning approach. It has not been fully legalized like in more developed countries. Hence, the related ministries have not been taking these matters seriously, leading to poor planning and implementation. However, it became a pressing issue that the government needs to act on. There is a category of people that is unable to afford the instruments needed for e-learning. E-learning such as computers, printers, broadband network, and even a hand phone. To cater to certain households' incapability to purchase these gadgets, the government introduced the Kelas at Rumah, a daily television show that is available on a free-to-view television channel. In addition, the Malaysia government also took some initiative to provide 1 GB free internet through selected telco companies throughout the movement control order. While the last challenge that the Malaysian have is the poor and the new poor, as they say. With a poverty rate of 19.5% based on the 2019 poverty line, Sabah has almost 100,000 households, forming some of the country's poorest communities, and now years of effort to decrease poverty to this level have gone out the window. Following the arrival of COVID-19, for many of them, their struggles began with the nationwide lockdown that was first imposed in March. The pressure on low-income households will continue to mount so long as the health crisis prevails. But to help minimize their suffering and keep the economy going, the government has unveiled stimulus packages totaling 305 billion RM. There is also free feeding, but there are still aspects that can't be controlled by the government. This is reporter Francesca. Back to you in the studio, Kathleen.
Thank you, reporter Francesca. And as these diseases send fear to the people of Malaysia, the Malaysian authorities had created policies that are currently implemented in the region. Let us know more about these policies as reporter Bryan reports.
Hello everyone. As you can see, I'm currently under quarantine in a hotel in Bohu Baru area. And I will be presenting to you the details of the policies implemented by the government of Malaysia to fight against the COVID-19 in the country. First would be the Enhanced Movement Control Order. By this order, all residents and visitors within the area are forbidden from exiting their homes during the order. And non-residents and visitors outside the area cannot enter the area subjected to the order. And all businesses are shut down, and adequate food supplies will be given by the authorities during the 14th day order to all residents. And a medical base will be established within the area. And all roads into the area are blocked. Moving on, next we have the Semi-Enhanced Movement Control Order. From 14 May 2020, the Pudu area in Kuala Lumpur comes under Semi-Enhanced Movement Control Order because there was a spike of new cases in the Pudu area, and the government has said that it would impose Semi-Enhanced Movement Control Order and Enhanced Movement Control Order on areas that are at risk of COVID-19 outbreak or have seen a spike in new cases. Moving on, next we have the Conditional Movement Control Order. In this order, most economic sectors and activities are allowed to operate while observing the business standard operating procedures such as social distancing and recording the names and telephone numbers of customers and the dates of their visit. And sport activities involving large gatherings, body contact, and other risk of infection are not allowed, including all indoor and stadium sport events, outdoor sport activities which do not involve body contact, in small groups without an audience and involving not more than 10 persons are allowed on the condition that social distancing is practiced. In social, community, and cultural events, which involve large gathering, as well as all type of official events and assemblies are not permitted. Religious activities and all congressional or assembly activities in house of worship are not allowed. And interstate travel, including the Balik Kampung tradition for Eid al-Fitr, is not allowed except for work purposes and to return home after being stranded in the hometowns or elsewhere. Moving on, next we have the Recovery Movement Control Order. By this order is the recovery phase of the Movement Control Order under Recovery Movement Control Order. Further restriction of Movement Control Order have been eased, such as allowing even more businesses to reopen and interstate traffic. As of today, due to the Delta variant that is affecting and killing people's lives, the government imposed reinstatement of Movement Control Order restrictions. By this order, there will be a travel ban between states and districts and limiting travel 10 kilometers away from homes and stay at home orders and only allowing 2 people per household to travel in cars and buy groceries, and banning social gatherings, including weddings, seminars, and sport, and eateries and hawker stalls can only provide takeaway services and deliveries. And only 5 essential economic sectors are allowed to operate: manufacturing, construction, services including supermarkets, banks, health services, trade, distribution, and plantation. And outdoor recreational activities limited to people from the same household, and non-essential workers to work from home, and 5-person limit at mosque and other place of worship. By these policies, it helped to reduce the spread of the virus and keeping the citizens safe. This is your reporter, Brian. Back to you in the studio.
Thank you, reporter Brian, for these very informative insights regarding the policies implemented in the region. Moving forward, levels of cooperation are still ongoing within member states in ASEAN. The ASEAN Emergency Operations Center Network for Public Health Emergencies, or ASEAN EOC Network, was actually led by Malaysia, and they are tasked to do sharing in the situational updates every day to be aware about what's happening in the ASEAN member states. They have 3 information that they should be tackling, such as the prevention, detection, and response measures to the ASEAN Senior Officials for Health Development, or ASEAN, and plus 3 other countries such as China, Japan, and Republic of Korea. This is to be on top of real-time information sharing through online communication within member states. To add into that, ASEAN Plus 3 Field Epidemiology Training Network, or ASEAN Plus 3 FETN, currently chaired by Malaysia and coordinated by Thailand, wherein they have been conducting a series of informal video conferences to share experiences on the latest developments of national responses to COVID-19 outbreaks and how field epidemiologists are important in implementing these responses. Malaysia, as chair of the network, led the informal video conferences through its knowledge sharing platform. ASEAN Risk Assessment and Risk Communication Center or ARARC is also led by Malaysia, and Public Health Laboratories Network on Responding to All Hazards and Emerging threats is also present. Despite the cooperation and attempt of combating COVID-19, the country is still struggling to lessen the cases in Malaysia. To further sum it up, continuous cooperation is still ongoing and aid from member states is still open to help the Malaysian community through cooperation at national and regional levels with development and dialogue partners. They are also into keeping supply chains open to all member states and as well as giving importance to the newly scientific researches. Again, this is Kathleen Quinto together with our field reporters Bryan, Mary, Reyn, and Francesca reporting the COVID-19 case in Malaysia live in ASEAN Studio.